testing is done on the third trimester of pregnancy, together with the CBC testing, so as to test for anemia, as diabetes and anemia are the main complication in the third trimester of pregnancy. I got this scenario, which is, let's say that a 33 years old woman, G4 P3, is at 25 weeks of gestation. She has gained 30 pounds for this pregnancy. With her last pregnancy, she gained 60 pounds. She was diagnosed with gestational diabetes and delivered a 4,300 gram a female neonate by cesarean section. She wants to know whether she has a diabetes with this pregnancy or no. I'm gonna show you how to test for diabetes in pregnancy in a simplified way.
Diabetic testing in pregnancy. Diabetic testing in pregnancy is composed of two parts. The first part, or the first test, is called the
1 hour 50 gram oral glucose tolerance test. So in this test, you would give the mother 50 grams of glucose, and you will wait 1 hour. After 1 hour, you will test the blood for glucose level. Normally it's equal to less than 140 milligram per L. In 50% of all pregnancies, it will be abnormal, which is greater or equal to 140 milligram per liter. Here, you will need further steps and go to step 2. Whenever you get a
result of greater or equal to 140 milligram per liter in the 1 hour 50 gram oral glucose tolerance test, you would go for a test called
3 hour 100 gram oral glucose tolerance test. So this is a definitive test for glucose intolerance in pregnancy. You'll ask the patient for overnight fasting, and you will test the blood for fasting blood sugar. So normally it's less than 95 milligram per dl. The patient will be diagnosed as overt diabetes light if the result is greater than 125 milligram, and in case of the result is less than 125, you will administer 100 gram of glucose to the patient, and you will test the blood after 1 hour, after 2 hours, and after 3 hours. So after 1 hour it has to be greater than 180. After 2 hours it has to be greater than So the normal values of 1 hour later, it has to be less than 180. After 2 hours, it has to be less than 155. And 3 hours later, it has to be less than 140. And now I'm gonna show you the criteria of when to tell whether the pregnant woman gets a gestational diabetes. So out of these 3 measurements or values, it has to be 2 out of 3 abnormal criteria. Example, here I have patient A and patient B. Patient A gets 190 over the 1 hour later, which is abnormal. It's greater than 180. 2 hours later, she gets 140, which is normal. 3 hours later, she gets 139, which is normal. So patient A is said to be she gets no diabetes or gestational diabetes. On the other hand, patient B gets 170 1 hour later, which is normal. 2 hours later, she gets 180, which is abnormal. 3 hours later, she gets 155, which is abnormal. So here she gets 2 out of 3. This is the criteria. And patient B is said to be she gets gestational diabetes.